So first I would like to ask for your permission to use this video for educational purpose.
Yeah, that's fine.
Excellent. Now tell me, what do you do for a living?
I farm and do a lot of welding repair.
Well, hard worker,
Yeah.
heavy labor, is that correct?
Mm-hmm.
So tell me, what were your symptoms before the surgery? How were you doing?
Very crippling. Most days, by supper time or before supper, I'd have to lay down on something flat and try to relieve the pain. I couldn't get through a day without laying down at dinner time and for sure by supper time.
How long did you have those symptoms before the surgery?
I had back pain. I had hurt that. It's been over 20 years.
20 years, but then it was getting worse toward the end,
Mm-hmm.
to the point that you just couldn't get by. And I think we did still lots of physical therapy and other treatment before the surgery.
Yeah, lots of injections and physical therapy.
And they did not help you.
No.
And then we went through the surgery about a year ago. Is that about right?
A year to the date almost. Yeah.
Excellent. Now, how was the surgery? Do you remember?
I don't really. It went good. I got out of there, I think, the next morning.
Now, how long after the surgery did you walk?
Within a couple hours, when I came through, they let me walk up and down the hallway.
And this is not a normal thing to just walk a few hours after surgery or go home next day, but we could do that because we did the OLLIF procedure, the minimal invasive, where we, instead of literally filleting your back open, we use a smaller incision, and with those small incisions we cause much less damage to the tissue. And I'm going to first show the pictures on the computer that literally shows that we did the L5S1 OLLIF. Here we see the screws all in the perfect position, and the bone actually beautifully growing inside where the bones are what we call interbody fusion. In the back of the bone we see still a little bit of a gap. Bones start to grow, but it's not as strong as we wish it to be, meaning that the healing is still ongoing. Obviously we are on a good track, but tell me, how are you doing now? How are your symptoms now?
I'm doing good.
You said your usual pain that you had before the surgery was gone when?
Right away after the surgery, that was gone. Yeah.
But I bet there are still some activity-related symptoms that you still had after the surgery, and you may still have them. But you told me something. How is your pain now these days, realistically?
Pretty low, I would say. You know, most days I don't really have pain until if I spend a long day in the shop or something. Late afternoon, I'll start to feel a little pain.
Yeah, but I think those activity-related pain, some of them we can explain that your body just gives you your limit. Some of it we can explain that the healing is still, at least in the back part, is ongoing. But I think we are on track overall. Do you think the surgery helped you?
Yes.
Excellent.
Yeah, absolutely.
Well, I'm happy to hear that, and thank you for the interview.